We go back to health matters, and the Kenya Union of Clinical Officers now say failure by government to address the clinicians' strike, now in its 84th day, points to the complete lack of commitment by government to address challenges facing the health sector.
The union, whose members have been on strike since the first day of April, noted that out of the 10 demands, only one has been met.
They marked the 84th day since the clinical officers downed their tools. It is a strike that the union leaders have termed as the longest by clinical officers in history, with no resolution in sight. Among the demands by the clinicians include finalization of collective bargaining agreements, implementation of payment of 15,000 shillings risk allowance, issuance of letters of promotion by county governments, recruitment of over 20,000 clinical officers to bridge existing gap, among others.
When you ask us to enter into a return to work agreement that continues discrimination of the contracted workers, which is against Article 27 of the Constitution, then they are basically asking us to sign ourselves into an illegality and forfeit the rights of our members. And that has been one of the major issues that we have had and where we have not been able to agree.
Our 10 agenda that we brought on the table have not been addressed. Only one have been addressed. And also the fragmented way of management in the health sector with the Council of Governors, where they continue holding different positions in issues that pertains to health, specifically on the issues of the UHC, where there have been a projection to put them on a permanent and pensionable. The other part of the Council of Governors holding a different position. And that has actually resulted for them to be extended on punitive terms.
The union leadership is further accusing the counties of Mombasa, Kiambu, Kisii, Vihiga, Homa Bay and Embu of harassing, intimidating and withholding members' salaries. Clinical officers in Embu are set to hold regional demonstrations to protest what they have termed as intimidation and coercion by the county to return to work.
Instead of the employer listening to us, they are moving into intimidation, and that is why you find that some of the facilities are running.
Haufai kulipwa ile kazi ambayo hujafanyia. Ndio sababu tuliongea na wao na wale walikubali, kwa sababu wote walikubali kurudi kazini na wote tukawarudisha kwa payroll.
The recent reduction in budgetary allocation to the health sector is also a matter of concern, with the union saying what the sector needs is more money to help actualize universal health coverage.
So how can you be on one side, you are saying that you want to guarantee Kenyans of their health, you want to improve the quality of the services you provide, but then on the other side you are cutting down on the budget?
The union, however, says its members will provide and coordinate medical emergency response teams in all affected counties during the planned Tuesday demonstrations to ensure timely medical intervention for those who may need it.
We will use our own resources to give services to those people who will be injured, including police, so that then we don't lose life in the line of them exercising Article 37 of the Constitution.
Nancy Okware, Sunday Express.